and welcome to our COVID-19 update, where we'll be talking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for joining us again today.
Thank you again for having me on the program.
Okay, so Minister, let's jump right into it. Last week, you would have mentioned that we would have seen some spikes in cases in Linden, Maracaby, and in Bartica. Can you give us an update on what's the situation there?
Well, it's getting a little bit better. Bartica, you recall, at the start of last week, we had probably about 6 or something cases. That's now down to 34. And as we had said before, that's because we've been doing discharges. And most of the cases that we've had in Bartica were really mild or asymptomatic cases. So we're very happy that we have started to discharge people, and we have now reduced those numbers. We expect that the numbers would drop again over the next couple of days. As it relates to Linden, we have seen spikes in Wisma and Amelia's ward. So we have identified these cases. They are in isolation, and hopefully we'll see a reduction maybe by the end of this week going into early next week. We did a special exercise where we went out to areas along the UNAMCO road, and having done testing last week and brought back those test results into the lab and checked them, we now have about 29 cases around that area. So those persons have been informed, and we are monitoring them as well. So that's a new area where we have seen an increase in cases. In Maracaby, we did a similar exercise where we went into the community and did testing. So it's like a mobile type of testing. And again, we have seen a number of cases. We have had 29 positive cases in Maracaby. So this is a new area. We'll continue to monitor it. And of course, we have been giving advice to the residents in that community.
Okay, Minister, I know in Bartica you would have set up a permanent checkpoint for persons coming out of the hinterland, given that it's the Christmas season and it's probably the gateway to the hinterland. But Linden as well, you would have traffic going in and coming out. Are similar measures going to be put in place, or have they already been?
Yeah, there are measures that are there for persons who are coming in from other areas. But what we have also done was to go into communities, mining communities, and do testing. So we have been evaluating those results as well. Last week we had a number of teams that went into different areas in the mining districts. And we have done both antigen and PCR testing on those persons. And we have seen a number of positives based on the tests that we would have done there.
Okay, thank you for that, Minister. Now, on to Ocean View. I know you would have mentioned that all the patients are there except the maternity patients. How many patients are currently housed there?
We have moved all of our operations in terms of hospitalization of persons with COVID to Ocean View. So we are now able to do from mild cases right up to ICU patients. And we currently have about 10 patients in the ICU area. We have some more persons who are mild, and we'll continue to monitor them. We have an area in Ocean View that is designated for theater and so forth, but we haven't put that into operation. We're still sourcing the equipment. But in the meantime, for maternal patients, they can now, they still would have to remain at the Georgetown Public Hospital, and we have a special section where we have built so that we can test and isolate if they're positive, and they would be able to give birth at the hospital. Once we complete that section at Ocean View, then these maternal patients would go across there as well.
Okay, thank you for that, Minister. So it's the holiday season, a lot of people are coming home. What's the situation at the airport? How many cases have we recorded of persons who've tested positive on entry?
We have so far about 20 cases. of persons who came in, and on the second, when they do the test at the airport, we were able to find about 20 persons who were positive. We'll continue to monitor and make sure that we have this system in place, because the mere fact that we are finding positive shows that the system is working. We know that with the holiday season, there might be an increase in traffic, more people want to come home. But again, we want to tell people to be vigilant and to ensure that they abide by the rules that we have. Persons, as you know, are required to have a PCR test. There have been some confusion between a PCR and an antigen test. We do not accept the antigen test for travel. We want people to have a PCR test. So we hope that people understand what we are asking for, and that they follow these rules. Once they have that PCR test, and if it's within 72 hours, then upon arrival at the airport here in Guyana, then they can go free. If, however, it's beyond 72 hours, but within 7 days, then you're required to do a second test at the airport. So that has been what we've been using. As I said, it has been working because we have been able to identify a few people.
Okay, with that, Minister, I know previously, a few months ago, there would have been some issues with monitoring persons that come into the country but have not been giving their right addresses or not answering their phones as it relates to the team checking up on them to see how they're doing. How are we doing in that aspect of it?
Well, to counter that, what we have done is that we require people to give us their telephone numbers, and when we get the telephone number on the form, one of the persons at Port Health would normally call the number right there, just to verify that it's an active number, that it's working. So in that case, it minimizes the, not finding people or people giving wrong number. And then we have made that into a penalty. So if people give us wrong information, then they are committing an offense. So we want to ensure that people give us the right information, because it's helping to protect their health. And so far, I think we have been able to minimize these challenges with these two measures that we have put in place.
Okay, and what advice would you give to persons, either going out or coming in, traveling?
One of the key things is that if you have, or if you think you have been exposed and you have signs or symptoms of COVID-19, then you shouldn't travel. There are some countries that don't require any PCR testing, and people traveling to those destinations, they don't have to do a test. So they might have some signs and symptoms and still travel, but by doing so, they're putting other people in the plane at risk, and therefore, if you think you have been exposed and you have signs and symptoms, don't travel. We have seen a case in the United States where somebody who had signs and symptoms, they weren't smelling, they had fever and all these other things, decided to travel, and that person died on the flight. So there are cases that we have to be vigilant, and I would advise people, if leaving Guyana, if they want to depart from Guyana and they have signs and symptoms, don't travel.
Okay. Now, Minister, before we wrap up, some weeks ago you would have mentioned the rollout of the National COVID-19 Vaccine Task Force. Are you at liberty to say who are these persons that are on the team and who's heading it?
There are a number of people who are on the task force. The task force really is it's a body to ensure that Guyana is ready, start the preparations for vaccines, and to make sure that we have all the things in place. So we have a number of persons who are familiar with vaccines, not necessarily adult vaccines, but vaccines in general. And other stakeholders who would be on the committee. So it's a multi-stakeholder kind of a committee. We would release the names during this week because we have been talking to different people to include them on the task force. And we are about to complete that exercise. And once we finish the exercise, talking to people and so forth, then we would finalize the list, and we will release that during this week.
Okay. So that's the list of names of the persons.
Yeah.
Are you at liberty to say what organizations would be comprise the?
What we are looking for is expertise, specific types of expertise as it relates to vaccine. So whether people have expertise in terms of cold chain, or whether they can help us with logistics, whether they can help us with management and so forth. So those are the kinds of things that we are looking for.
And it's not governmental, it's both public and private partnership.
It's both. You have lots of people from the public sector because, as you know, a lot of our vaccination is done by the public sector, the majority of it. So we have included a lot of those persons who have been involved with our vaccination program because they have the know-how.
And the private partnership, is there anybody from the private sector?
We have persons who are in the medical private sector who would be working with us.
Okay, thank you so much for that, Minister. This has been our COVID-19 update. For more information, visit our website, dpi.gov.gy, or social media platforms.